Hello everyone. Today's lesson is about tracheoesophageal fistula. A fistula is an abnormal communication between two epithelial lined surfaces, and an atresia refers to a complete obliteration or absence of an orifice of a hollow organ. And a stenosis is a change in diameter of a hollow organ to become a narrower, and it can also be called a stricture. A tracheoesophageal fistula is a congenital disease. It is acquired communication between the trachea and the esophagus, and most of the patients with tracheoesophageal fistula are diagnosed immediately following after birth. And tracheoesophageal fistula are often associated with life-threatening complications soon thereafter. Approximately 70 to 17% of children with tracheoesophageal fistula have associated developmental anomalies, and these anomalies include Down syndrome, duodenal atresia, and cardiovascular defects. And tracheoesophageal atresias are a common congenital anomaly with an incidence of 1 case in 2,000 to 4,000 live birth infants. When we say about etiologic factors for tracheoesophageal fistula, the etiology for tracheoesophageal fistula is multifactorial. So there is no a single etiologic factor for tracheoesophageal fistula, but certain etiologic or risk factors include maternal alcohol and smoking during pregnancy, exogenous sex hormones, exposure to metimazole, which is antithyroid hormone, and prolonged mechanical ventilation via endotracheal or tracheotomy tube, maternal polyidraminose, and in first trimester exposure to high blood sugar is thought to be certain predisposing factors for tracheoesophageal fistula. When we see classification of tracheoesophageal fistula, there are different classifications of tracheoesophageal fistula. From this, esophageal atresia with distal tracheoesophageal fistula, isolated esophageal atresia without a tracheoesophageal fistula, isolated tracheoesophageal fistula, esophageal atresia with a proximal communication, esophageal atresia with proximal and distal communication. As we see on the image, the most common type of tracheoesophageal fistula is type C. That means atresia with distal tracheoesophageal fistula. That means esophageal atresia with distal tracheoesophageal fistula. It is responsible for around 86% of cases. And the second most common is type A, which is esophageal atresia without tracheoesophageal fistula. And the third one is type E, which is called tracheoesophageal fistula without atresia. That is called H type. And type B is atresia with proximal tracheoesophageal fistula, and type D is atresia with proximal and distal tracheoesophageal fistula. When we see pathophysiology of tracheoesophageal fistula, upper part of esophagus is developed from retropharyngeal segment and the lower part of the first part of primitive gut. And at 4 to 5 weeks of gestation, the laryngeal and the tracheal groove is formed, and two longitudinal furrows develop and separate the respiratory tract primordium from esophagus. And deviation cellular growth of the septum results in formation of fistula between esophagus and the trachea. So it is due to deviation of cellular growth of the septum that separates the esophagus from the respiratory tract is responsible for developing tracheoesophageal fistula. When we see sign the septum of tracheoesophageal fistula, most patients are diagnosed at birth, and there are 3 C's for tracheoesophageal fistula: choking, coughing, and cyanosis. Those things are so common in tracheoesophageal fistula, especially for type 3, which is the most common type. And other clinical manifestation is excessive secretion immediately after birth, intermittent unexplained cyanosis and laryngospasm, abdominal distension, violent response after first or second swallow of feeding, such as infant coughing, choking, fluid, and the fluid returns through the nose and the mouth, and also poor feeding and inability to pass catheter or any tube. For diagnostic evaluation, we can do ultrasound scanning, and the most important thing is failure to pass any tube into the stomach through the nose or mouth. And we should have to take X-ray while the NG tube is in situ to know the location of the NG tube. And pH of tracheal secretion, flat plane X-ray of the abdomen and the chest, barium X-ray, electrocardiography, those things are just to check for other concomitant abnormalities that is present in different organ system. When we see pharmacologic management, propping infantis at 30-degree angle is important, and we should have to keep the patient NPO, otherwise the patient will aspirate everything. And the nasogastric tube remains in the esophagus and it is aspirated frequently, and the supportive therapy including meeting nutritional requirements through IV fluids or through parenteral nutrition and antibiotics, respiratory support, and maintaining neutral environment is needed. The treatment is surgical, so prompt primary repair is needed. Fistula found by bronchoscopy is divided and followed by esophageal anastomosis of proximal and distal segment if infant weight permit and it is without pneumonia. If the child is not having pneumonia at that time and if the infant weight permits, dividing the fistula and anastomosing of proximal distal segment of the esophagus is needed. And regarding staging, initial fistula division gastrotomy are performed with later secondary esophageal anastomosis or colonic transposition performed approximately 1 year later to effect total repair. This is so staging surgery or different surgery. The other is circular esophagotomy, and it might be performed on proximal pouch to gain length and allow primary anastomosis at initial surgery. And the other is cervical esophagotomy. This is when ends of esophagus are too widely separated and esophagus replacement with segment of the intestine, especially for example colonic transposition, is done at age of 82 to 24 months. After surgical intervention, certain complications can be there, such as esophagitis, esophageal stricture, recurrent fistula, deaths from asphyxia, pneumonitis, and dehydration can happen. Thank you for your attention, and don't forget to subscribe this channel.